Hey, good evening, everyone. I'm Jodie. I'm the specialist bariatric nurse at Salford. So hopefully most of you know me or know of me. This evening is our patient experience evening, so my absolute favourite evening. So before I introduce the ladies who are going to give us a little talk, a few updates. I know that there's lots of anticipation for surgeries getting going again at the Oaklands Hospital. So for those of you who might not be aware of this, when surgeries go ahead, it's either at the site at Salford, so the NCA hospital there, or at the Oaklands Hospital, which is a private provider of ours across the road, where it's our team of surgeons and we use their facilities so we can get more surgery done. Unfortunately, that was subject to a pause last October, and I've been waiting to hear, for me, waiting to see that we get our patients done, and I can happily say that we've had 2 lists over there done and completed, and I've been reassured and seen that people are getting sent over month by month again. So that's brilliant. That means that where we've had a little bit of hiatus, a bit of a bottleneck with actually getting surgery done, and that seems to have lifted now, so that's fantastic. I know that we've also been doing extra weekend activities. So for those of you who might be joining us for the first time, we like you to come to these sessions, use the recording resources so that your knowledge around bariatric surgery is as good as it can be for you to make an informed choice of whether you'd like to be referred on for bariatric surgery once you've completed your time with your weight management services. And from that referral to meeting our team, the waiting list is around a year. And then meeting our team, there can be waits for psychology and sleep studies and other things that we like to do before you proceed for your surgery to be safe. So we've been doing additional weekend clinics to try and get that year wait down as much as we can. As some of you may know, there's lots of things going on around the commissioning of weight management services. So some weight management services don't exist anymore. So we had a big influx of people that were being referred to us. So we're trying to make sure that we keep our waiting time under a year and even less than that if possible. So there's work happening, and finally things are going, that we should see real results for, that will make the journey for you all the better. So I'm going to hand over to Stevie now. Stevie works for ABL and she facilitates this with her team there. So I'll let her introduce the evening. Thank you.
Hi everybody, welcome this evening. Thanks for joining. We've got a massive 270 attendees today, so that's great. We are going to be going through a few presentations, so I just want to let you know kind of a few housekeeping rules. What you'll see on your screen is a few different boxes at the bottom. One will be a Q&A, so that's where I would like you to direct all your questions that we'll answer at the end of the session. We'll have about 30 minutes where Jodie can answer some of your questions along with our presenters tonight, which is fantastic. And please refrain from saying your hellos in there, because it makes it really difficult for me to get through and make sure we're pulling out the questions that you guys really want answered. There is a chat box, which is where I'll post the link to the closed Facebook group where you can get peer support from everybody here. And we'll post any updates about this session there. And then I'll also post a survey at the end of the session, which you will use and complete to register your attendance here tonight. And then we can make sure that your tier 3 services have access to that when they're referring you on. I think that's it for me. Other than that, we've got quite a few people in the background that will be answering your questions by text if they can do as well. So enjoy the session. I know we've got some fantastic story to be shared tonight, and I'm going to be welcoming in Corinne Bolland now, who's a PhD student from the University of Salford. She's going to be talking you through her research and asking for some participants. So Corinne, whenever you're ready.
Okay, thank you. If you can give me a heads up when you can see my screen, if that's okay.
Yeah, no problem. If you share it, I'll let you know.
Okay, so you should be able to.
Yeah, so if you just pop it in,
see this, and I'll go into presenter mode.
Yeah.
Is that okay?
Perfect.
Okay, so hello everybody. My name's Corinne Bolland, and I'm a PhD researcher at the University of Salford. And briefly, my background has been working in weight management programs and studying eating behaviours since 2014. And my current research has found that our standard weight management programs may not be as effective as they could be, and that there are some evaluations reporting that participants may not always leave programs feeling empowered to manage without ongoing support. But promisingly, empowerment is now a key priority of UK health policy. So when we look specifically at ways of supporting empowerment, we can see that empowerment processes are governed by 3 values, and that is the ability of service users to be able to make their own decisions and to determine their own actions aligned with their own goals, needs and values, and the assumed capacity that the people using services can participate in decisions that are affecting their own welfare. And then we look at the distribution and the equitable allocation of resources within those services. Now, when we look at the evidence of empowerment within current behavioural weight management programs, we can see that there really is no agreed definition of what empowerment looks like, and that there is no agreement on a way to support empowerment within programs. And particularly, there is no evidence from UK programs for us to draw on to be able to make effective recommendations. And so at this point, user participation is critical, and stakeholder participation is recommended when examining what empowerment actually means. And so this brings me to my study that I'm currently conducting, and that is to support a need to understand empowerment in a UK context within weight management programs. So my first study will be to complete a series of interviews, and this will be across adults who identify as living with obesity, but it will also be to speak with people who commission weight management programs, and it'll also be to speak with people who provide or deliver weight management programs for us to be able to get a better understanding of what empowerment means. And then once we have a better idea of what empowerment means, we'll get a clearer picture of how we can support empowerment through these programs. And I would say kind of incorporating the voices of people who will be using these programs, I think, is of vital importance, and it will really support what is needed to support empowerment, to empower service users so that they can then be able to maintain good health. And this was really a very brief overview of this research, and I'll put my email address in the chat so that if anybody does want to get in touch for more information, they can do. And there is a QR code here on this poster that will take you directly to the information sheet. I don't know if you're able to scan this on your phone at the moment, but again, you can email me for more information should you need it. And that was all really. I just wanted to share my research so that people in receipt of services, people who are using services, or people that have got experience previously of services are able to contribute and give their views. So that's all from me. Thank you for listening, and I will hand back to Stevie. Thank you.
Thanks, Corinne. Jodie, over to you.
Great, thanks so much, Corinne. As always, we're really blessed with the group of patients that we have. Always keen on getting involved in research. So I know that you do get asked a lot, but I think it's really important, and we keep waving the banner to make sure that obesity and significant treatments for obesity are highlighted and taken seriously by people in the scientific community and across the board. So thanks, Corinne. So let's go to our main event. So we've got patient experience. We've got 2 lovely ladies who are a little bit further down the road since having bariatric surgery, who are going to share their experience with us, and then we will do the Q&A after. So enjoy. Over to you, Helen.
Hi, hope you're all okay. I did put another photo on here, but it's not shown up. It's a recent one I've had done, but it's not on this slide. My journey started probably about 4 years ago. I went through 2 cancelled on day procedures, but I eventually got my surgery July last year, 15th of July. I had my start weight, I think at my biggest I was about 105. I think I was about 103 kilos once on surgery day. I've done okay, and I'm at 66.8 kilos today. But I'll just go through some slides with you. If you can do the next slide for me. Right, so like I say, I'm 56. I was, like I said, 4 years ago, started my journey, feeling broken every day like you do, hating yourself and everything, that all the emotions you go through. People used to say, oh, you're so pretty, why don't you lose weight? Words that you don't want to hear. So I was always the bigger, fatter friend, and you always put the happy face on because you're the fat friend, even though you're dying inside. Eventually went to see my GP, who put me through to the weight management program at Lee. Unfortunately, that's stopped now, so I do feel for the guys that were going through Lee. You're given lots of tasks to do, appointments to attend, and then eventually, you know, I went through sleep studies, psychology studies. Don't be frightened about them. It's just part and parcel. Just take it as part of your journey. Then eventually got my my surgery date, which was 15th of July last year. Can you do next slide? Yeah, so like I said, my surgery, I had 2 different days and it was cancelled, and you sat on the ward and everything's going through your mind, and you just feel gutted when you come out. But they, you know, the team at Salford are great, and they do, you know, keep in touch with you, and they try and get you in again as soon as they can. My surgery went fine. I woke up in the night though not feeling too well, and ended up somehow with a bit of a post-op infection. I stayed in for 5 days. The team was amazing, looked after me all the time that I was there. The pain, it's bearable. You know, it's uncomfortable. I wouldn't say I was in excruciating pain. It's just you've had a lot done. I had a Roux-en-Y and a hiatus hernia repaired at the same time, so I had quite, you know, quite a big surgery. I didn't feel hungry. I was just thirsty, and getting your mind round where you can just used to be able to pick a drink up and have a big drink. You can't do it, so you just got to keep sipping and sipping. You get through it. Then, you know, the first few days aren't great, but it's just the start of your journey. So you've just, at the end of it, you know, you've got the goals to look forward to. Do the next slide, please. So the liquid stage wasn't as bad as I thought. I didn't really sort of miss anything. I think I just really set my mind to, you know, this is what you've got to do. You've got to accept it. The puree stage, like I said, it's a bit like baby food, but at least it's a little bit of texture and taste after being on the liquid. Then I went on to the soft food, and that just feels like heaven. Even though you can only eat small bits, you feel it just feels great that you can finally eat something. Now I just eat off a little side plate. I can eat most foods. I do sort of struggle chicken and meat, but I was never a big chicken and meat eater anyway. I use lots of Quorn products, and I find that I am fine with them. You do soon learn what suits you and what doesn't. And I can even have a glass of wine or 2 next, like now, and you know, I don't really miss that sort of morning after feeling or the reflux that I used to get. So that's another bonus. Can we do the next slide? Yep. So my normal life now. I've been really lucky as yet, touching wood. I've had no dumping syndromes. I think it makes you really mindful of what you're putting in your mouth. Know your limits. If you think, oh, I'll get this extra mouthful in. I don't. I just throw it in the bin. I don't want them feelings. So I know when I've had enough. I can go out now and have meals with my friends and family. I just opt for a starter portion to come out as a main. So and I can, you know, you're not missing out. You just got to, you adapt. It's your new life, and I think the quicker you can get your head around it, that, you know, you're not going to be able to gorge on everything. That's good, but you know, you can still go out and you can still have a life after surgery. I do miss, the only thing I really miss is having toast and a brew at the same time, because you can't do both together. And I don't really eat much bread at all anymore, when I used to eat a ton of it. Let's say your vitamins for life, your B12 injections with your GP, get your protein in, because that'll help you. My blood pressure has gone now. I don't have blood pressure medication anymore. I go swimming again now, which I enjoy as well. There's a lot. I've found so many health benefits. I've not had chub rub these last couple of weeks when it's been warm, and that's a bonus, as you ladies will know. Can you do the next slide, please? So ups and downs, you are going to go through bits, and you're going to think, this is never going to happen for me. And at times you'll just think, I'm going to give in, or I'm going to go to Turkey or whatever. Don't do it. It's not worth it. It really isn't. Your day will come. The pain will ease. Hair loss, I've been really lucky. A little bit of thinning on sort of one side of my hair, but I've been really lucky. Some people, you know, do have more hair loss, but I've been all right. Up to these last few weeks, cold. I've never felt cold like it, but I've lost a lot of what I call my excess blubber. That's gone now. So, you know, it's strange. I've never like feeling cold. I wasn't used to it. And then change to your life, but it's not forever. You can have a normal life again. You can do things. You can do more things and enjoy more things. So, could you do the next slide? So your new life, and I've found myself again. I'm happier in myself. I love swimming again. I try and go. I haven't gone as much these last couple of weeks, but it's been nice because I've sort of been in the garden a bit more than I should. Just shopping. I enjoy shopping. I hated shopping. It used to make me feel depressed. You fit into clothes that you didn't think you'd fit into, and it just makes a massive difference. You feel so much better when you pick something up and it doesn't fit because it's too big. Aeroplane seats are more comfortable. You're not squeezing yourself in. And you can smile again, and it's you're happy. You're genuinely happy. You're not going through all that pain that nobody knows you go through every day. And the next slide. So this is me now and my partner. I have lost more weight since then. But yeah, that was a bit of my story. So thank you for listening.
Oh, thanks, Helen. That was really lovely. Thank you so much for sharing that.
No,
Okay,
you're
then
welcome.
Sharon, let's go over to you.
Hi everyone. I'm Sharon, and I can't see my slides yet, so I shall write. Okay. Okay, sorry, I'm just waiting for it to see what I'm saying. Right. I'm going to start. First of all, can I say thank you to Helen, because I thought her talk was really good. I know, I don't know if anybody can see the slides, because I'm afraid I can't. So you don't know what I look like at the moment, but I'm 71 years old and I now weigh 82 kilos. I've sort of plateaued. I had my surgery in 2022, so I'm 2.5 years in. And as a person, I'm a lot happier than I used to be, because where I am, I feel that I have benefited so much from having had the surgery, and I've got the support and had the support of people like Jodie and Chris, and also by attending the various Zoom and face-to-face meetings that have taken the place. So that's me a few years ago, but it's probably worth commenting that I don't have that many photographs. Jodie asked me if I could provide some photographs, and I had to search because as a fat person, I avoided the camera, or else I was taking photographs of other people. But I'm quite happy to be photographed now. So if we could move on to the next slide. That's me sort of about, I'm trying to remember, that's me about a year ago. Again, I don't have that many photographs, but the hair changed colour and the body slimmer, and I feel so much happier looking like that. Next slide, please. So also, I mean, basically I've covered most of those things, but having had the opportunity to have the surgery, especially on the NHS, because I think there's been so much about going and people paying for surgery. I think nowadays we are bombarded with information about losing weight, the different ways, the jabs. And certainly when I started my thinking about trying to lose weight, because I've been a failed dieter over the years, it seemed to be something that you heard that it was only celebrities that did it, people that could afford it, you know, the Vanessa Feltzes of this world and various Hollywood people that opted or were able to pay for surgery. So I do feel very fortunate that I've had the surgery. Next slide, please. To go back to a bit of my history, I think I had my adenoids out when I was about 5. And before that, I was a child that needed to be coaxed to eat. I can remember my dad saying, just have a little bit, you know, try and eat something. And the family joke was that I lost my adenoids and gained an appetite. And then I started getting bigger and bigger. I wasn't a very overweight child, but I then gradually became one of the bigger children in the class, and was conscious of being overweight from childhood onwards. I did lots of different diets over the years. Some of them were quite bizarre thinking back on them. There was one, believe it or not, where you were injected with your own urine. Goodness knows how that was meant to work, and it certainly didn't. I had to pay for it, bizarrely. I also tried hypnotherapy, which was very pleasant, but unfortunately it didn't actually help me lose weight. So I stayed sort of overweight for quite a long time. But about 10 years ago, I think it was a conversation with the GP, I live in Bury, and Bury were doing a scheme where I could have signed up for potential to have weight loss surgery. I didn't hear anything back, followed it up with the GP, and about a year later, I was told, well, you don't actually meet the criteria. They never said what the criteria was, but I didn't meet them. So within that 10-year period until being accepted for bariatric surgery this time round, the heaviest I got to was about 120 kilos, which I certainly was very uncomfortable. And I don't think there's any photographs of me at that weight. So, as I said, I'm 71 now. I was just coming up for 69 when I had surgery. And I was still working when I was 69, but I decided that in what I class as my third age, so first stage being growing up, second stage working, and I worked for almost 50 years. So being a retired person was going to be my third age. And the last thing I wanted to do was to be a fat old lady when I retired. I didn't want to be sitting at home stuck in front of the telly or not doing anything and just sort of fading away into my retirement. So it was time to do something. So can I have the next slide, please? So 2018, I started the actual process of going on my journey. I went along to various interviews, and I was told, yes, you're suitable to join the program. So I started going along to classes. I think they were on a 4-weekly basis. Went into the centre of Manchester, and I met up with other people. We did wonderful exercises like carrying shopping bags, but it was the being part of a group. I found that very, very important, to be with other people who were on a similar journey. We all had our different reasons for being on that journey at that particular time, but I found that having the support and the participation of other people made a huge difference to me. That's the way I work. It's not that easy to do things on my own. I benefit from being in an environment with other people and getting the support from that. And it's a mutual thing. So I managed to achieve by 5% weight loss without too much difficulty. And I think one of the best moments was when my waist measurement was measured, and it had dropped by 5 centimeters, which was fantastic. So I don't even think I know what my waist measurement is now, but I know that it's significantly less than it used to be. So I've got nothing but thanks from the people on the ABL team, and that really did help me stay motivated. So once I'd gone through that, my attendance record was exemplary, apparently. Not like it is like it was for school, but never mind. So at the end of 2019, I went through all the different interviews and, as Helen mentioned, the psychiatric assessment and everything else. So at the end of 2019, I was accepted for surgery and had the discussion and even got to be a consultant. And then guess what? COVID. So 2020, COVID, and everything stopped. So that put things somewhat on the back burner, unfortunately. So can I have the next slide, please? So the picture on the left is more for amusement. That's what I looked like in the summer of 1976. I love those flares, and my hair is no longer curly. But the one on the right is probably about 20 years ago. So as you can see, I've not been slim for a long time. So can I have the next slide, please? So what happened was, once we got through lockdown, and unfortunately I did put back on about 4 of the 5 kilos that I'd lost. But then I discovered, watching what was happening, that I discovered that the surgeries were taking place again at Salford. So I got back in touch. I was actually given one date, but it wasn't convenient because I'd been invited to a wedding, and it would have meant I'd have had to start my liver reduction diet about a week before I was going to a wedding, and I didn't fancy that. So I got it changed. So October 2022 was my date. And I was quite prepared for the liver reduction diet. I'd done a lot of reading up to make sure that I knew what was expected of me. And I think I was probably dreading it at first, but the reality was, actually, it's not that bad. It's literally 2 weeks. You're cutting down, and if you think what's going to happen at the end of it, then yes, you'll do it. It's very important. I certainly didn't want anything to go wrong. I didn't want them to turn around and say, you haven't lost it, you've not cut down for the 2 weeks, so we're not going to go ahead. It wasn't worth that risk. And as I say, in the grand scheme of things, after 69 years, what the heck is 2 weeks? So it was worth it. And then I had my surgery at the Oaklands. One of the reasons you're given for having surgery as the Oaklands is that they don't really anticipate you having any problems. So you don't need to be at Salford. It's perfectly reasonable for you to go ahead at Oaklands. Now, there are definite pros and cons about having surgery at the Oaklands, and I might seem a little bit frivolous, but I think it's worth mentioning. One of the things that I was aware of, you have to go just before the day before the surgery, they want to take fresh blood. I honestly think it would have been better if I had brought a vampire bat or something, because they couldn't take any blood from me, or should I say, the doctor couldn't take any blood. So my tip is never get a doctor to take blood from you. Get a nurse, because the doctors haven't got a clue. I was black and blue in both arms, unfortunately, but that's just unfortunate. However, what made up for it, and more than made up for it, was the fact that if you're in an NHS hospital, and I've been in quite a few over the years, you get a cup of tea and it's perfectly drinkable. But if you are in the Oaklands, A, you're in your own room, and B, they bring you tea with a teapot and a doily under the cup and saucer on the tray. So that's certainly worth going for. I know that sounds silly, but it was a very quick experience. I was only in there for about, I think it was less than 36 hours. The only other problem was, though, that, and apparently this was a one-off, and I hope it's a one-off, I was given lots of information about what to do, the anticoagulants that you have to inject yourself with it, and unfortunately it turned out that I was allergic to them. They brought me out in a very unpleasant rash. But I was told to expect a follow-up call from the bariatric team at Salford. I didn't get one, so I rang them, and apparently the message that I'd had the surgery didn't actually get carried across. But since then, I've got nothing but praise for the bariatric team at Salford, I have to say. Next slide, please. So I did get over the operation. There were a few minor issues. There were a couple of days when I felt great, a couple of days where I felt a bit woozy and slightly lightheaded, but I did keep to the dietary advice, go have your liquids, then your purees, then your slightly lumpy food. Again, I think I was possibly lucky because it was going into the winter, so things like soup and porridge were more than palatable. But if you think, again, it's only short term, it's not the rest of your life. So in the grand scheme of things, I would say to people, don't worry about it. There's so much support and advice that it isn't really a difficult, or I didn't find it to be a particularly difficult experience. I will hold up my hand to saying that I did unfortunately experience the dumping syndrome. It's not nice, but it doesn't last very long, and you will realize what causes it, how it affects you, and you learn how to avoid it. So now I think in the last 2 years, I've probably, well, I should say probably in the last 6 months, I certainly haven't experienced it. Again, to echo what Helen's saying, you do have to change habits. You don't eat and drink simultaneously because you're getting it. Your body doesn't like it. You will recognize what your body likes and what your body doesn't like. So now, the way I am, I have got so much more energy than I used to have. Obviously, I'm getting older and that has its impact, but that's in a different way. So I don't know if anybody knows Heaton Park, which is very close to where I live. But it's got the highest point in Manchester. Well, before, when I used to go there, I used to walk up the hill and stop about every 5 yards, turn round to admire the view. Now I go straight up and admire the view from the top. So it's little things like that. Those are my pointers to my success and how I feel about myself. I can look in a mirror and think, you look better than you did. I'm not perfect. I still got chunky legs. I don't think they're ever going to be the way I would like them to be. But nowadays, it doesn't matter. You know, I can wear trousers, whereas I know my mum used to be a bit self-conscious because women of a certain age didn't wear trousers 50 years ago. So, but I'm happy in myself, and I feel that I have gained so much more. And also medically, um, I used to use inhalers. I haven't used an inhaler for over 2 years now, and I do suffer from arthritis. Unfortunately, when I was in my 30s, I was hit by a car and had a badly fractured pelvis. And as a consequence, in 2006, I had to have a hip replacement. And my consultant at the time said, "Oh, you'll probably need a revision to have it done again after about 15 years." And I still go for regular checkups. And my consultant has said to me, highly unlikely that you would ever need a replacement. So from one point of view, that's potentially saving the NHS quite a lot. And I feel good about that because I've had surgery. I've noticed that a couple of people over in the last couple of years that I've mentioned that I've had surgery. And when they've looked at me, I said, well, no, I didn't pay for it. I had it on the NHS. And again, there were raised eyebrows. But I don't feel guilty about that because there's a positive. I've had bariatric surgery. I'm fortunate. But hopefully, I won't need a further hip replacement. I'm not using inhalers, and my general health, my general well-being has improved significantly. So I think they're all positives. So that's my story. And all I would like to do is a big thank you to people like Jodie and Chris and the ABL people and you for listening to me. So thank you. And that's me at Blackpool. So thank you.
Oh, Sharon, that was fantastic. And I love the last picture of you with the sunset behind you. It's just the perfect slide, wasn't it, to end to end it with. So that's just great. Thank you. So Helen, if you're happy, can you put your camera and unmute yourself, and then we'll do some question and answers. So I know there's been quite a few questions. I know that there's quite a few people in the background here trying to answer more specific ones that aren't necessary to do with our talk tonight. So Stevie, have you seen any that would be useful to ask Sharon or Helen?
Yeah, so I don't know whether this one might be a little bit more for you to answer, but somebody's asked what is dumping syndrome. So Jodie, I suppose if you can explain what it is, and then maybe Sharon, you said you'd experienced it. How did that actually feel?
Okay, so first of all, what is dumping syndrome? It's a horrible word. I don't really like the word, but basically it means that after surgery, we kind of replumb, or food is going to go very quickly into bowel. You don't have a stomach for things to hold in for a couple of hours, churning around and getting digested. So the bowel isn't used to having food that you've chewed really well in your mouth go into gut that quickly. So if it comes across something that it thinks is offensive, it will try and flush it out of your system quickly. So if you have anything too sugary, which is the main culprit, too greasy or too starchy, it will try and flush that item out. And the way it does that is your body will take fluid from your circulating blood volume back into the gut to flush the offensive item through. So when you think of your blood volume, that's your blood pressure. So you'll have a drop in blood pressure when that happens. So you might feel a bit woozy or a bit odd. You might get some stomach gripes. You might feel a bit sick or even perhaps be sick. You'll more than likely have an episode of diarrhea. And I think that's why it's called dumping syndrome. I'm presuming. In the first instance, it's usually something you've ingested in the last half hour. and sometimes you can get something called late dumping, and that's more to do if you've had something really, really starchy, but mostly sugar again. So if you've had anything that's too sugary, your blood sugars initially will go, whoa, that's a massive hit of sugar. Get all the insulin on board. We've got to get rid of this sugar in the bloodstream. It's too high. It's too high. And then because it's overreacted to whatever it was and the body started to flush it out, you'll get like a peak of your blood sugars, but then you'll get a massive trough because of how your body's dealt with it. So up to even 3 hours after whatever it is that you've had, you might get palpitations, sweat, you might be incredibly fatigued, you might just need to go to bed. But usually within that 3-hour period of whatever it is, all the signs and symptoms of dumping syndrome have gone. So your body will pretty much deal with it and everything's fine. So it can feel pretty awful during that time. Everything I just described is the very worst case. You may not get all of those symptoms. You may just get a few. Some people get a bit confused if they eat something too fast, they're really uncomfortable, they feel like they just want to be sick. That's not dumping syndrome. Dumping syndrome is definitely to do with the type of food you've had. And it's not normally because you've eaten something really stupid. Well, not stupid, that's the wrong word. Something that you're well versed not to have, like, oh, I'll have a chocolate bar or something like that. It's usually where you get caught out with hidden sugars. So it might be the thing that says no added sugar. That doesn't mean it's sugar free. Or it could be fruit. If you have lots of, for example, like an innocent smoothie, they look healthy, it seems nice, you're on a liquid diet, why not have some fruit? But it's a lot of fructose. There could be 20 oranges squeezed into that little packet. So you have to just be mindful of the type where the sugars are coming from. So you get quite savvy at looking at the labels, and there's lots of tips in the nutrition booklet. If you think, oh, I haven't had a nutrition booklet, or I don't really know what the liver reduction is, that's okay. When you come to meet our team at Salford, we send through an email with lots of information, but hopefully during all of this you'll learn more about it and look up resources, and then that'll be when you get that education email from us and the Q&A session with us, it just kind of consolidates all the things that we hope you know from these sessions. So Sharon, have you had dumping syndrome?
Yeah, I have. Funnily enough as well, because I had experienced it without realizing what it was, because for religious reasons I fast once a year, so it's a 25-hour fast, and I've learned that if you try, because when you completely fast and we don't have any food or liquid, and when you start eating and you think, God, I'm really hungry, I want to have something, and you have a bit more. And then afterwards, I started feeling a bit lightheaded and started to get stomach cramp. And so since the surgery, that's how I've been affected. I start feeling a bit woozy and lightheaded, and then get a bit of stomach cramp. Unfortunately, the diarrhea follows, but it does pass quite quickly. But as I say, I've learned to recognize any symptoms, or so as I say, I've managed to avoid it. It isn't pleasant, but it is short term, and it does make you think about, I don't like that, I don't want that to happen again.
Yeah, and it can be more pronounced with a bypass, just because with a bypass there will be about 190 centimeters, so not a little bit of bowel, like a lot of bowel. It's no longer plumbed for food to go through, so you do tend to find that dumping syndrome after a bypass is more pronounced than after a sleeve gastrectomy. How about you, Helen? Have you ever had any dumping syndrome?
I've been really lucky, none, and I don't want it neither. I think I'd read so much about it. I've just sort of, foods, like I say, you do get really savvy. You're reading labels all the time. You're watching sort of what you're adding or not adding into things. I've been very, very lucky. But like I said, touch wood, I've not had any. But I am really mindful of what I do eat.
And I
So
think you get a lot of taste bud changes as well. So a lot of, we know that actually now, even though sugar-free is good, because so many processed foods have preservatives and fake sugars, we're learning that our brain's almost assimilating that as a fatty, sugary food. So even though we're on those things, people are still maintaining or even gaining weight. So we are becoming a bit more of purists in our community, you know, home cooking, knowing what we put in stuff, making our own snacks. If you know you live with families or if you've got kids, it's kind of becoming, well, if you want a treat, make it, and then you're not as tempted, and then they're getting the benefits of you know, one, knowing how to cook, but two, what's actually in that snack rather than all the nasties and preservatives that that can also jeopardize weight as well and weight loss. So
yeah, I think it's looking, like you say, the fructose and things, and like the hidden things, you know, you just got to be careful. And I've been very lucky that I've not experienced it, and I don't want to either.
And to be honest, in most of the follow-ups I do, not many people do. Some
Yeah.
people wish they did
No.
more. I'm like, no. And that's
No.
because it's obviously once you kind of wean back onto normal food, that you know it isn't completely unreasonable that you can have the odd treat or things that kind of come into it. It's usually knowing the amount and the type of thing that you're having. So yeah, you get savvy, but obviously in the first 6 months you probably you're still very much clear because you're trying to get into new habits and you're trying to avoid problems, and you're trying to get to that solid diet and learn your restriction and understand how to get you through regular meals again. So yeah, brilliant.
So the next question is from Danielle, and she says, do you guys still get cravings? And if you do, what are they for and how do you deal with them?
I'll answer. I don't tend to do. The only thing sometimes, like I say, I've mentioned, I'd love to be able to sit and have toast and tea, but I know that I can't have them both together. And bread doesn't agree with me anymore. A little tiny bit of sourdough I'm all right with, but lots of bread things I avoid. They just felt like they'd sat heavy. And now, because, you know, if I go out or anything, you become very mindful of what you have. You know, look at starters and things like that, and look at healthier things. So I don't feel like I'm missing anything because I eat virtually everything that the family eats. And now, but I just make sure it's healthy and just the small amounts. And when I've had enough, I get up and throw it in the bin. I've been quite lucky. I don't know, you've been, Sharon.
Well, that's interesting because the thing that I crave more than anything, which might sound strange, is tea and coffee. I find one of the things that I find is difficult to drink water. I've never really been a water drinker other than when it's incredibly hot. I cannot drink any fizzy drink at all now.
No.
And that is, I didn't drink that many fizzy drinks. I don't drink alcohol anyway, but I find fizzy drinks are a complete no. And it took a while before I could have anything acidic. And I've always liked things like pickled beetroot and gherkins and pickled onions. And I found that very difficult to tolerate it first. But I know it sounds silly, even though it was unpleasant, I persevered because I really like things that are slightly acidic. But in general, I can't. I'm sorry to upset you, Helen, but I can't eat toast.
Oh.
But I restrict it because I used to have a couple of slices, and one of the things Georgie was always says, and I'm sort of very conscious of it, is like bite size about 20 pence piece. And it's very true. If you take small mouthfuls and chew it carefully, it does make you feel fuller. You're still eating the same amount, but I tried it because I always used to eat quite quickly. And by taking small mouthfuls and chewing it thoroughly, I could be about half the way through a slice of bread and think, actually, I've had enough.
Yeah.
So it's just little things that you might not think about, but it can make a huge difference.
Yeah. I think I've wanted to avoid sort of more, because my downfall, I'd have bread, more bread. So I think I've just learned that it's not good for me. I've just avoided it, and it's only now and again. you know, if you see an advert or something, or you see somebody out in a cafe and they're having like tea and toast together. But other than that, you know, I can't say that I really miss anything. I was never a big sort of sweet toothy, cakey kind of eater. Mine was more savoury stodge than anything. Which you can't do it anymore. So you retrain your brain really, and your body, and you learn to accept like what you can have and what you can't have. And now I'm so much happier in myself. I don't feel like I'm missing anything, if that makes sense.
Good. That's
Thank
really
you.
good. I
One
know
of the-
in
Sorry,
sorry,
Joey.
Stevie. I know in follow-up, some people do sometimes still feel hungry, and then Chris will talk through very much about a dedicated snack and the predictors of weight gain after surgery, and kind of grazing and nibbling is one of those.
Yeah.
So you do want to try and get to those sort of set meal patterns and proper meals. You don't want it to resemble something that the rest of the family aren't having. It's really important. But I do have quite a few people that really love a carrot. Sounds silly, but there is a sweetness to it, and there's crunch and there's texture, and it's, you know, it's like anything, isn't it? If you right now you might think a carrot, really, but then when you've had surgery, it's a different experience. It's not like going on a diet. So it's funny what you think you would like that you don't, or things you've bought in and then you have it, it's really heavy and odd and you don't want that. So you just have to sort of really see it as you're weaning a newborn baby, and then you've got a brand new palate, so you can explore things again. You don't have to think, oh no, I don't like prawns. How do you know? You're brand new.
Yeah, exactly.
Mind you, I'm worried
Oh.
about the carrot because I broke a tooth on Saturday by biting
Not
into
a
a chunk of
carrot.
carrot. Yes, yes.
On a carrot.
Unfortunately, yes.
That was one
was
big carrot.
Oh, no.
No, don't listen. My sister, my older sister who lives in London, I was having a conversation with her on Monday night, and she said, "Oh, I'm going to the dentist on Wednesday." I said, "Oh, fair enough." She said, "Yeah, I broke a tooth." So two of us have broken a tooth. I don't know whether she ate a carrot or not. She said she was eating salad. So
Right, grated carrot for you from now on.
absolutely, absolutely, and I
Just
like
taking that
carrots.
texture away.
Yeah.
Thank you. So one of the next questions is, how have your families reacted or coped with your surgery journey?
Mine been really supportive. My mum didn't want me to have the surgery, was absolutely, she was going, no, please don't go, please don't have it done, please don't have it done. And I think they've seen how well I've done and how I feel in myself now. They've all been really, really supportive. My sister's always been a big girl, and she's joined Slimming World now to give it another go because she's seen the change in me. So I've been lucky. I've only had one sort of negative comment the whole time, and that was from someone I've not seen for a long time. And when she said, you know, you look really well, I said, oh yeah, I've had surgery. And the first comment was, oh, you're one of them. And I was like, you've not got a clue what I've been through all my life. The 4 years it's took me to get to the surgery. And I just walked away. I just thought, you know, you don't need that negativity. I'm proud of what I've done, and my family are proud. And, you know, they all say to me now, you know, how well I've done and how much better I look. And I just think, you know, I've been very lucky with my family. Very, very lucky.
Thank you, Helen. Sharon?
Yeah, my family are sort of a bit different. I got divorced many years ago. My ex-husband had got to the stage where he had said to me, I think I remember the words very clearly, "You disgust me." So that's why he's my ex-husband, but he died a couple of years ago. I've got two daughters. One of them I don't have much contact with. The older one, I deliberately didn't tell her until about a couple of weeks before the surgery because I know she would have driven me mad. But she's not angry with me, and she's very pleased that I'm pleased with the result and she can see a difference. But I've got a lot of friends, people I was working with, who have been incredibly supportive. I've been really good about it. I didn't hide this, I didn't broadcast it until I knew that it was actually going to happen, because I didn't want to go off work and then come back as a somewhat different person. So I've been actually very honest about it. All my friends have been very supportive. There are a couple of people that I saw and were quite concerned. They said, "You've lost a lot of weight. Is it good?" And I said, "Yes, of course it's good."
Yeah.
And so I think they can see that I'm happier myself. You know, family members like cousins and my sister, you know, they all have been very positive about it. They recognize that I'm a person that I will make my decisions. And nobody who did know tried to dissuade me. So I'm very happy about it.
We've had a few patient experience presentations in the past, and one of the ladies said she would encourage people to be aware of their family whilst they were going through this process, because they'd noticed that their partner or children or people in their household would finish what was left on their plate, and it could be quite easily that person that's kind of finishing what's left on the plate could start to gain weight. I wondered if Helen, that had been anything that you'd experienced. Like you mentioned throwing it in the bin, but I wonder if you
Yeah.
do throw it in the bin or if anybody's picking off your plate.
No, I throw it in the bin, but what I need to train my brain is I'm not cooking for as much anymore.
Yeah.
So I do tend to sort of, they are having a little bit more food than they should. So I've had to sort of, you're just so used to making a certain amount of food. So yeah, now I'm having to think, no, you don't need that extra potato. You don't need that extra this. You don't need that extra that. So I've had to sort of retrain my brain that, you know, I'm like cooking for, like, I've got my partner, my son who's like 23, and basically me as like baby food size portions, not 3 adults. So yeah, at first I was overfeeding them. I think I've become a feeder to them, but now I sort of, yeah, I have sort of cut back now on what I'm doing. Definitely, but yeah, I can understand that they weren't finishing my food because I was only putting such a small amount on, but the plates were like massive.
Piled high. It's kind of we don't want to waste food either, do we? So that's the thing. So it's kind of ingrained in us, and we need to kind of work on that. Okay, thank you for that. So Isabella's asked, how long did your recoveries take?
I'd say for me, because I'd had that first little, I wasn't very well in hospital, but I'd say after I'd had my staples out, I felt like that was a big sort of thing, because I felt a bit restricted with them because they were getting a little bit tight. So I'd say after about, I think I was back at work after about 4 weeks. But my job's in community and I was running here, there and everywhere. I probably could have gone back if I'd have had a bit of an easier job at first, but I didn't. But, you know, I'd say I went on holiday in the October as I had my surgery in the July, and I was virtually back to everything. You're talking 4 to 6 weeks where you've just got to be a little bit more careful, and you're still on like your limited food and your soft foods and things. But I think everybody's different. So I think depending on your jobs and things like that, I think you've just got to listen to your own body when you're going through it, and advice off other people and things like that.
Yeah, we tend to give a sick note for 2 to 3 weeks off work, and then obviously depending on the type of work you have, you may want to do a phased return. Some people note when they start the weight loss journey that they get a bit of a peak of energy because they've done the liver reduction and then they're losing weight. Some people don't lose weight at all. Their body thinks they're in a weird famine and it's holding on to everything, and you're kind of shape shifting, like you're losing weight, but on the scale not as much. And the whole process, your body metabolizing for fuel differently. So energy peaks can be at different times, but I think that 3-month time, most people start to really notice, oh yeah, I'm better, I'm back, I'm better, you know. So 2 to 3 weeks, I would expect you to be doing all your normal activities as you were before, albeit a bit more carefully, albeit one thing in the day is going to maybe set you off for being more tired. But yeah.
Karen, what was your experience?
Well, I realized I didn't say I actually had a gastric sleeve, and my first week was really difficult because, as I mentioned earlier, I had the reaction to the anticoagulant. So I was very miserable. But once I got that out of my system, um, I didn't find it too difficult with the diet, being on liquids, and I was able to get enough energy. So I think I had a fit note for about 3 weeks. And my job, I only worked, but at that stage I was only working 3 days a week anyway. I'd reduced my hours. And it involved going out visiting people, but there was so I didn't actually go out driving to visit people till about 6 weeks after the op. But I would say by about 4 weeks afterwards, I felt fine. I was able to do lots of things, but just be careful because I didn't want to risk anything going wrong.
Yeah.
But I didn't. As I say, around about 4 weeks, I felt fine, and I was sort of champing at the bit to go from pureed food to more solid food because I felt okay. So I would certainly say by 6 weeks, I was virtually back to whatever's normal for
Yeah.
me.
Thank you. So Rachel has asked, how has surgery affected your ability to take medication? I think she's asked specifically about the bypass.
I had gastric bypass. Medications, as in what we take now, or
Did you have to take medication beforehand, and
yeah,
has it changed since then?
Yeah, I was on blood pressure medication prior to that. Pain meds. I was just, hip pain, knee pain, every pain you could think of being overweight. Don't take that anymore. I'm off my blood pressure medication. The only tablets I take now are my vitamins and my supplements, which I have prescribed. Other than that, I'm on no other sort of for anything medical other than my vitamins. I'm not on anything now.
I think Rachel might be asking specifically about the method of taking medications. Has anything changed? So did you have to take any liquids instead of any big tablets? Like
yeah, at first you do the liquid paracetamols, and then the liquid omeprazole, the lansoprazole liquid. File. It's not nice, but you've got to get it, and it's just one of those. It's just something you accept that because you can't take them tablets at first. You've got to get it as liquid form. It's not nice. It tastes absolutely disgusting, but again, you forget about it. You have to take them, and you've been through the surgery. You need to take them, so you just got to accept it. You just get them down. I used to have a little drink at the side of me because you can't do your big drinks, but I used to have a little drink at the side of me, get it down, and a quick sip after it. But it's nasty tasting. It's not pleasant.
Sharon, anything from you on that one?
No, I mean, I was on sort of various medication because I've got an underactive thyroid. So that was actually quite useful to have because I wasn't aware that it affected me, but it meant I got free prescriptions for the last 40 years. But I don't think that's probably the way to look at it. But yeah, I still take tablets. I was taking tablets for blood pressure, the omeprazole, you name it. And I was using inhalers, but I don't use inhalers at all now. I'm still on blood pressure meds, but I've been trying to get an appointment with my GP to discuss it, but my blood pressure is good. It's properly controlled. I've just recently had blood tests, well, a couple of months ago, and apparently the dose of thyroxine can be reduced a little bit. So it means more blood tests, but I'm not bothered about blood being taken. Again, as I say, as long as it's by a nurse, not a doctor. And again, it's vitamin B12 injections. That's not a problem. Swallowing tablets. I did have, because there was one multivitamin that they gave me when I was discharged from the hospital, and it was was huge. Well, it looked huge. And for some reason, I took it and I ended up being sick. So that made me a bit wary. But now I just take a multivitamin, the Centrum. I take that twice a day and I don't have any problems with it. And, you know, all my blood levels, all the vitamins and everything, it's like the scientific table, all the things, magnesium, you name it, everything seems to be fine. So swallowing tablets was not difficult. And you get into so I have my routine. And I think once you get into routine, it did take a few weeks to get into a routine of what to take and when to take it, but it's fairly straightforward now. Don't have a
Yeah,
problem.
so we're going to do a talk with our pharmacist about medications and our medical bees. So I know there's been quite a few things about weight loss injections, and a lot of people sometimes at the moment, I'm hoping there's going to be lots of legislation and lots of GPs more confident to prescribe these and have the funding to prescribe these. But most people go privately for weight loss injections that I'm aware of, and we do meet people that have been referred and come through to Salford and have chosen to go to use injections, and that's a personal choice, and as long as that's monitored and safe for you, because there's lots of side effects, and having monitoring is really important. And I think now for you to do this privately, they are a little bit better at making sure that, you know, bloods are right and they know your conditions from your GP and things like this. But I've just noticed a few questions in there, so absolutely we will still meet you if you're on Mounjaro for weight loss, and you've been referred to us, of course, come along if you want to take that. That's absolutely fine, not a problem at all. Just something to be aware of when if you are on this medication and then you're given your date for surgery, you need to stop taking Mounjaro, Ozempic. There's obviously, you know, there's lots of different kinds of these GLP-1 antagonist injections, so you need to be off them when you start the liver reduction. Just something to be aware of if that is a medication you're taking. Bariatric surgery will often boast that it can put type 2 diabetes into remission. So that's something that's quite exciting. Things like obstructive sleep apnea, you may have had it before surgery. Normally with weight loss, quite quickly you won't have it anymore, which is brilliant. You normally know that because you either wake up less or you wake up more rested, or your partner's saying you don't snore so much anymore. I know you're nodding there, Helen. And then Sharon was saying just then about how she's monitored her own blood pressure and seeing that it's great. She still takes some medication for blood pressure, and that's because very often when healthcare professionals meet you when you're quite overweight, they'll often think the weight is the reason everything's not right, and we will see. So some people will have high blood pressure because of their weight, and sometimes they'll have other conditions for why they have higher blood pressure, or their heart needs that help. So just a word of advice with that is, if you do monitor your own blood pressure, that's quite good, because at least you can see that, you know, it's in good levels. But if you don't, that's fine, but do get those reviews with your GP, because even though you'll have follow-up with us, if your blood pressure normalizes and you're taking a blood pressure medication that will lower your blood pressure, that can potentially then mean you'll run with a low blood pressure, and you might get side effects of that, which would be feeling dizzy or lightheaded, especially that classic one, you know, where you go to tie your shoelace, you stand up and the wheel's spinning a little bit. So that's a good indication to not take that medication. Ring your GP for an emergency appointment so they can review your meds.
One of the next questions is around loose skin. So I suppose, what were your thoughts prior to surgery on loose skin, if you had any? And then what has your experience been since having surgery?
Yeah, I've been very fortunate. I've always had like the mummy tummy anyway, so I've still got that bit of a flabby thing, but I do swim a lot now. I've still got like under my arms are quite flabby, but I look at myself now and I think it's a price to pay. You know, somebody said to me, a good pair of knickers will hide the skin, don't worry. And mine isn't that bad. I was showing the girls at work today because they're always fascinated. How's your skin doing? I've been very lucky, but I think swimming's helped me. It tones. I'm not a gym person. I don't like the gym, never have done, but I enjoy swimming. So, and I think that's helped toned me as I've lost the weight.
Mm.
Yeah, you know, I've got it, you know, a bit on my legs and my belly and that, but overall, I think how I look now with the loose skin, I'd sooner look like this than how I did, squeezing myself into things and being uncomfortable. And yeah, I'm fortunate. I'm not that bad.
Helen. Sharon?
Yeah, I can remember. It's an interesting question. I can remember actually during the psychology assessment, that was a question I was asked. You know, how would I feel about, you know, sort of body shape, body image, and if I had loose skin? And I remember saying, well, I've never owned a bikini. You know, at the age of 70 or 71 as I am now, I have no intention of buying a bikini. I'm fortunate that I'm in a way that I'm quite fair. Well, I am very fair skinned, so I don't tend to expose that much skin to the elements because I burn very easily. From the old photos, you can see that I was a redhead and I've got the freckles. Yes, I've got the bingo. I've still got the bingo wings. Unfortunately, I never learned to swim. I've got a bit of a phobia about water, but um, yeah, my skin's not perfect. I don't mind that because I knew
Yeah.
that that was likely to happen.
Yeah.
So, and being that bit older, I have never bared my midriff deliberately. So the bits that I don't want to be visible, I can hide. And I suppose I have an advantage by being that bit older anyway. But even so, I think gravity helped because I've noticed that the bit of me that's thinner is sort of across the neckline. Okay, I'm getting older, so I'm getting, showing bits of me, but it's lovely to have shoulder blades,
Yeah, it is.
visible. So there are advantages and disadvantages, and okay, so I'm not perfect. I've never wanted to be like a model. I've shrunk. So it's positive. Like Helen says, it's part, but it goes hand in hand. And if I was that desperate, I would think about doing something, but I'm not. I am so much happier now that warts and wrinkles and all, I'm so much happier with it.
Yeah,
And I wear bikinis. I don't care. I wear a bikini. If they don't want to look at me when I'm on holiday, don't look at me. That's what I think now.
good,
Brilliant.
good. Yeah, I saw a few questions around this, and I know that having excess skin removal with the NHS is harder than getting bariatric surgery, to be fair. But we did manage, when we got our trauma unit over at Salford, we did manage to get them to just write a little bit in for our bariatric post-op patients to see if they would consider meeting people that were finding excess skin difficult. And they said that because you have a sort of annual follow-up, or roughly annual follow-up, with our weight management team, which you can go to for the rest of your life. If during that journey, once weight loss has plateaued, if people are a BMI of 40 or below, and having debilitating issues with excess skin, then that's something where we could ask them to see you. We can't make guarantees that the NHS will then remove excess skin, and they have always had a caveat: they'll only do an apronectomy, so they wouldn't do thighs or arms. And I've met people who've gone, I don't know why, but it's just my thighs that get me down, and I find this really difficult, but because it's just chaffing and other things that they're dealing with, and that's really hard because they just don't make a pathway for us on the NHS. So I think that is part of the reason it's talked about in assessments and along the journey, because it's just not fair to have an expectation of something that's really difficult to get. So I think it's about understanding that this is something you might be living with, and how you feel about that.
I don't know if this question's probably a little bit more for you. So somebody's asked, will we stop losing weight, and at what point will that happen? Because they're quite scared of that happening.
Do you mean stopping losing weight?
Yeah, post-surgery.
Okay, so how many years are you down the road since your surgery now, Sharon?
Well, it's 2.5 years now.
And when did you notice your weight loss kind of plateaued and sort of stopped?
Probably to be honest, it was probably about a year ago.
Yeah, 18
I
months
sort of,
is
yeah,
very
around about
typical.
18
18 months
months.
to 2 years,
Yeah.
you plateau out. Yeah, and what about you, Helen? How far down the road are you now?
I'm still probably losing, might be only about £0.5 a week now, but I've lost quite a chunk of mine already. I'm at 66.7 or 8 now when I weighed myself this week. So I've not got that massive, you're not going to be losing pounds and pounds a
Right
week.
down.
So
Yeah.
I'm losing probably about just steadily away about £0.5 a week, sometimes a pound, but more sort of £0.5 to £1 a week
How
still
long is
now.
it since your surgery, Helen?
July last year.
Yeah. So we're still very much on the journey, as it were, and it will massively slow down for you now.
Yeah.
You kind of have that rapid weight loss that kind of starts and gets going. It's always like a stair. Very, very rarely do people lose in a neat curve. Some do. Some are like, oh yeah, 1-2 pounds a week and it's all happening. And other people, it's very much like nothing, a drop, nothing, and then the nothing gets longer, and then a drop, and so on. And we do know from the longest term data that we have that there can be a bit of regain at the 2-year mark. Sometimes that people have surmised that maybe it's a bit of a buffer effect, so hunger might kick in a little bit more, but because you've used those 2 years to get into a new relationship with food, that routine, the way of eating, the portion you're eating, the time you're taking to eat, all those things that should hopefully be kind of instilled and quite robotic, it's much easier to cope with. And I think statistically, and this is international surgeries, internationally, it's hard to get the data. I'll try and see if they can get some data for us. But weight regain, it is a big issue. And I think when, hopefully, because of your awful long waits, if anything, you're more prepared and you're more wanting to make sure this one opportunity is the lifestyle change you're hoping for. So you don't tend to, we don't, so even though there can be regain, I think the statistic was 35% from 4 years plus after surgery. And I think that's, and it's always that it goes back to very commonly nighttime eating and grazing. And there'll be different elements. So you realize that it wasn't just the tool, it's a sort of almost a psychological thing. And that's really difficult because you will be offered psychology or offered food and mood groups or support with this during your weight management service, but you might not think there's anything really to support. You might think, well, I haven't got an eating disorder and I don't think I really binge eat, I just know I overeat here and there, but there's normally a lot more to it. So I would urge you all to take anything up that you're offered, because getting psychology after surgery I find really difficult, and I bang my head against the wall all the time because I feel like some of our patients need that and they go, oh yeah, that's fine, we'll accept this referral, but it's a year wait. And you're like, not another year wait, I want to have some support now. And it's really difficult, and you'll be signposted to a lot of talking therapies, which are great, actually, they're really good. You can self-refer and it's quite quick, but they may not have that speciality. So I think really looking at this whole process as body and mind right from the off is really important.
Can I just a brief thing? I held on to a lot of clothes because I thought, well, just in case, I don't want to have to buy another lot of clothes. And round about 6 months ago, I thought, this is silly. I've reached this weight. I'm happy. I'd like to lose a little bit more, but I'm happy being so much lighter, thinner, healthier than I was, that I thought, right, get rid of it. That's my old life. I've got, one of the things I said to the psychologist is, she said, well, what do you want? And I said, I'd like to buy clothes that have a number 1 in front of the number rather than a number 2. And I've achieved that. So I wear clothes now which are either a size 14 or a size 16, whereas I'm wearing a size 24 and a 22 before. So I've made that. It's not just the weight that sort of reached a sort of a plateau. It's my mindset as well. This is how I'm happy. I'm going to keep myself like this rather than allow myself to slip. So there is that mindset as well.
Yeah, and that can be a battle, because like anything, you have good mental health days, you have bad mental health days, and it's just trying to think about the toolkit you're going to have for that emotionally after. So yeah, switching ways of coping is really challenging for all of us, surgery or not surgery, isn't it? But I think when food has always been a crux, especially at a difficult time, it's kind of thinking, okay, right, how do I address that? How do I deal with my stresses and my anxieties as well? So yeah. Okay.
It leads us on quite nicely actually, because somebody here has said that they have been waiting such a long time and they feel it's quite difficult to remain positive. They almost feel like they might be becoming depressed again. Do you guys have any solutions for the long waits that you experienced, and kind of just what's your experience in that sense?
Yeah, I had that a few times, especially like when my surgery got cancelled. I came home and I cried like a baby. I did. And you feel so deflated at times, and you think it will never happen, it'll never happen. But you've just got to think you're on the journey, it will happen. Try not to get too, depressed. If you are feeling like that, talk to somebody, get the help. Eventually it will happen. And it is, you do have days where you get up and you look at yourself and you cry and you think it's never going to happen. It's never going to happen, but it does. It will come round. You will get your chance. Just talk to people if you feel that way. Don't bottle it up, and just think you're on the journey and you will get there. You will.
Yeah, I think my situation was a little bit different because I'm sort of almost embarrassed to say this, but I was told once I'd been accepted for surgery that it would, it was probably only going to be 6 to 8 weeks to wait. But as I say, then COVID came in, and it seems like a very long time ago, but it was
It's
just that
changed a lot.
unknown quantity, and not knowing. And I was conscious that I'd managed to lose the required amount and to be selected. And I thought, well, I can't allow myself to slip. I did slip a bit. I know I did. But I think there wasn't anything else to do. You couldn't go anywhere. If there was food in the house, you ate it.
Yeah, and I think that's it, isn't it? People aren't on this journey because weight loss is easy, or
No,
or even just weight maintenance being easy. Isn't you haven't had the surgery yet, you haven't even got to use the tool yet. So I know there's quite a few people there going, I know I've put the weight back on from when you referred. So please don't worry, please get that we completely understand that. That we know these weights are incredibly challenging and absolutely not what we want for our group of patients. And yeah, I think that the bariatric cohort are the most patient patients, and I urge you not to be that patient and do put in complaints, because it helps us when we're trying to say we're not delivering the service the way we want to, and we need more energy and effort to make it more. And we do get that from time to time, but it's still that capacity. So yes, COVID changed a lot, because we used to have a regular list at Salford. We used to have regular lists at the Spire and the Alex. And then after COVID, they didn't want to do those NHS contracts anymore. And then the Oaklands came, but then that can be subject to problems as recently we had, as we couldn't use it for a while. So I'm just absolutely delighted we can again. So yeah, it's really difficult for my bariatric patients, especially when they get cancelled once, twice. And to sort of tell people to prepare for that, that's not what you want your nursing role to be. You want to just be being with people after and supporting them and getting them through everything. So yeah, it is a challenging journey, there's no doubt about it, and of course it's worthwhile. But yeah, anything you're coming across where you're just finding things difficult, it can seem counterproductive, and if it won't bring you extra stress, then obviously complaints are useful. But for people personally, they can find that stressful in itself. But if that's something you feel you can do, when you realize I've been cancelled and then I've been waiting and I don't know and I've not heard, it's really hard for us as from a nurse point of view, because I don't manage those waiting lists. I don't know exactly where you might be. So yeah, it's difficult, and you might get hold of a secretary, they're really busy, and then you might not get hold of them, and these are the hardships that I know a lot of my patients go through.
If a surgery is cancelled on the day, is there a reason for that? Because I think if people understood why that might happen, then it's a bit easier to kind of have some rationale or a bit of understanding, or
Yeah, so
not that I think we
when
should be
you're
understanding when a surgery is cancelled immediately. It's hard, isn't it? But it might help.
So as I've said before, we like using our providers because we know that cancellations only tend to happen if say the anaesthetist is ill or the surgeon's ill, and that's quite rare. They tend to be a healthy bunch, luckily for us. But the main hospital, so this isn't exclusive to Salford, anyone who goes to A&E, and that has to be in a corridor now, that we don't have beds in the hospital like we should, and that's never getting addressed. I mean, it's in Parliament, it's every government, oh, we'll put more money in, we'll put more money in. So when it comes to elective surgery, they will put so many patients on a list, and they tend to put less, knowing that capacity can be an issue, because they know that cancellations can occur. And then on the day, there should be female beds, male beds available to go into. Now, if for any reason there's been complications for patients and they've had to stay in longer, or there's been an emergency who's come through A&E who now needs to be admitted, that bed goes. So then people get cancelled. And sometimes it's the prioritizing on the list. So there may be 3 there, and you may have been cancelled already, but there may also have been a cancer patient who needs that operation for curative reasons. So they will take a priority over you. So these are the challenges that the bariatric patients face, not just the difficulties with the hospital, but also the priority.
Can I just say, I was cancelled. I was twice on the day after, several hours, and it is so disheartening. But when you get home, have your cry, and then just think, right, you know, like you say, it could be a cancer patient, it could be somebody who's had a massive RTA somewhere, they need them beds. And I think after the first time, you know, second time, thought, oh no, I'll be all right this time, and it got cancelled again on the day, and it breaks you for a few days. I felt really broken. But you know, they do try and get you in as quick as possible. People ring you the day after, and you know, they do get you in, and within, you know, I was cancelled like twice on the day, but I did, you know, within a couple of weeks managed to get in. And I think once you've been there and you see the hospitals, I think it makes you really appreciate the pressures, and it makes you understand then why things do get cancelled on the day. So if you do, just think, you know, it could be a relative who needs that bed, you know, of your own. Just it is hard, but try and stay positive. I didn't. I broke like a baby, but
I think that's just incredibly human, because you psych yourself up, don't you? And you, like I say, you are the most patient patients. You do have long wait times to get there. So you're absolutely entitled to be a big puddle of mess and then pick yourself up again, and we get there when we get there.
And it will happen for you. It will. Have faith, it will.
Thank you. Jodie, this is something that I've seen on the bariatric Facebook support group as well. So I'm not sure whether this is the place to ask or not, but it's been asked a lot, so it's probably worth addressing. A few patients have received a text message asking if they still want to be on the surgery list because the waiting lists are extensive. So is that something that you would gone out?
So what was happening is we were saying to people, well, I always ask, and I've set up meetings and make sure that I can get information to tell people, and I always tell everyone everything I know. So I think sometimes they don't tell me stuff. I share everything. So when they were putting on additional weekend clinics, they wanted to write to everybody. Sometimes what will happen is the waiting list coordinators, they know how precious this is. I get them to send out emails, so we have a close relationship, and they will phone people and say, you can definitely take this one, because they're precious. We don't want any people not attending. So so we tend to try and protect our appointments and make sure every single one is attended. So I know somebody said before, what if I don't accept calls to caller ID, no caller ID? You can change that mode on your phone, absolutely, but they will write to you. So when we were doing these additional clinics, they didn't have the manpower to ring everybody up. So what they were doing was they were sending a generic text to everyone on the wait list in case people have gone abroad, in case people have changed their minds, whatever, just to make sure that everyone who's been referred, when they get letters to come to these additional clinics, that the chances are they won't be. Now, I have a colleague called Shirley, who's the care coordinator, and as soon as we know anyone's getting appointments, I also get her to ring. And she's very good, and she tends to just go through things with you about the day, the things you need to do. Again, just making sure nothing's missed, because sometimes people will come and meet us and they've waited so long on the wait list to meet us. I think something's changed. I think if you don't need psychology, maybe you've had some before, or you don't need that, a lot of people do, or maybe you've got CPAP already and you've had a sleep study. We don't need to wait to get those things done. And because you've waited so long, they're putting tighter controls on, which is great, because it means that, you know, chief executives are now looking at our patients saying we've got to find ways to get more done. So I am really optimistic this year that we're going to get a lot more activity done and these wait times will come down. So if you've received that text, it's because they are trying to make sure that we get wait times down. I know a lot of people have said, oh, I'm a bit worried because I don't know if you've had my referral. So as soon as we receive a referral from all the weight management services, we reply straight back to them to say, yep, got it. So a lot of people who are under Ashton, Wigan and Lee, if they were saying to you, we can refer you now, you're suitable for surgery, we got loads through and we replied back and said, yeah. So I guess if some of you are thinking, I think I've waited 12 months now, or I must be coming up to that. I think it was at 58 weeks, but now with the recent work we've done, it should be back under a year. And then if you can get in touch with your weight management service and just check that you received it. But I think, to be honest, we have, again, I do keep up relationships with all the referrers, so they know, oh, hang on a minute, I don't think we received a acknowledgement of this referral. So we try and make sure nobody gets lost. But if ever you're worried and thinking, am I lost? First protocol will be whoever referred you, because they should have that confirmation that can reassure you. And if not, you can contact the Salford Royal and ask to speak to the bariatric waiting list coordinator, just to check that you're on their list for giving out appointments. It's difficult. We can't be inundated. I can't, so we try and make sure that we can contact you, and you shouldn't have to contact us. But if you're really desperately worried that you're lost and you've done everything, you've not had any confirmation from your weight management service that you were referred, then that's the first place you should go back to.
Thanks, Jodie. Well, that actually takes us past 8 o'clock now, which has gone really quick tonight. What I will say is we've answered over 100 questions between us guys live and our handy helpful helpers in the background, so that's brilliant. I have shared the survey link, which will of course record your attendance today, which is great, but also help us to keep these sessions relevant and useful for you guys. So make sure you share your thoughts and your anything that you think we can do to make these sessions more useful to you. I just want to say a massive thank you to our speakers tonight and to you, Jodie. As always, this is a fantastic resource that we've got for our bariatric patients out there. So on behalf of everybody that's watching, I'll just thank you guys for presenting and being here tonight. But other than that, I think have a lovely evening.
Thank you, Stevie. Thanks, Sharon. Thanks, Helen. And thanks, everyone, for joining us.
Thanks. See you later,
Thank
guys.
you. See you. Bye.
Stick with it. Good luck.
Bye.
Bye-bye.